Hi everyone. On behalf of Pharmacists Without Borders Canada, I would like to welcome you to today's webinar, which is one of a series of webinars called Cross Country Conversations. This series looks at how the COVID-19 pandemic is impacting PSF Canada's missions around the world. Today's webinar will focus on the mission in Bangladesh. My name is Shirley Van, and I will be the host for today's webinar. I'm currently a pharmacy student from the University of Waterloo and a member of the social media team at Pharmacists Without Borders. Today we have Jaime Nead, our mission lead for PSF Canada's mission in Bangladesh. Jaime completed her Bachelor's of Science degree at the University of Ottawa, followed by her PharmD from the University of Toronto. Jaime has worked in both community and hospital settings and is currently a pediatric clinical pharmacist at the Children's Hospital of Eastern Ontario, CHEO, in Ottawa, Ontario. Thanks for joining me today, Jaime, to share with all of us more about PSF Canada's mission in Bangladesh. So to start off, where is your mission and what type of healthcare setting is it in?
Well, thanks so much for having me. So my mission, like you had mentioned, is in Bangladesh. It's located at a hospital called Square Hospital in Dhaka, which is the capital city of Bangladesh. So Square Hospital is a large private institution with 400 inpatient beds and is able to accommodate up to 1,800 outpatients per day in various ambulatory clinics, including oncology and dialysis. In addition, it also has several outpatient pharmacies, with one being open 24 hours a day.
Thanks for elaborating on that. So more about the mission. What are the top 3 objectives of this mission or project?
So the top 3 objectives of our mission were developed after I did an evaluation mission to Square Hospital in October 2019. So the 3 main objectives that we came up with really focus on clinical pharmacy, and they are first and foremost focusing on the antimicrobial stewardship program at Square Hospital. So really our focus is on creation, implementation, and surveillance of institution-wide evidence-based antimicrobial guidelines. Our second objective is patient counseling, or developing a patient counseling standardization model, with the focus really being to develop a standardized process or a standard work about the basic patient-centered counseling and helping to develop written communication that can be given to patients in the outpatient dispensary. And then our third main objective for our mission overall would be focusing on the integrated clinical care pharmacy program. So we're really hoping to develop an educational and training resources for pharmacists in order for them to take on a more clinical workload at Square Hospital. So this includes helping them to develop standard documentation tools and models for best practice. And our focus here will first be in the clinical care setting, and then we'll branch out to other departments within the hospital.
That all sounds really great, and also a lot of work to take on. So are there any other organizations you're collaborating with? And if so, how did that collaboration impact the mission?
So at the moment, there aren't other organizations that we're working with. It is just PSF Canada and members of Square Hospital working together.
And when did your mission start?
So the mission actually sort of started in the summer of 2019, when Zahidul Hassan, the clinical pharmacist at Square Hospital, actually contacted PSF Canada looking just for more guidance and for more assistance in kind of propelling clinical pharmacy into a wider audience in Bangladesh. And then following that, I was able to go to Dhaka in October 2019 to carry out an evaluation mission of the hospital. So at that point, I was really looking at the pharmacy department in terms of inventory management and also in terms of clinical pharmacy and what they were doing. And from there, I was able to come up with, those tangible goals for further collaboration with Square Hospital, and then the objectives that were listed.
And so in the past year, we've seen a drastic change in the healthcare system. And how did the COVID-19 pandemic impact the mission?
So COVID-19 actually had a huge impact on our mission. So like I had said, our first mission, really, the evaluation mission that I went on was in October 2019. And then a couple months later, borders were closed and the pandemic was unfortunately worldwide. So really, we've had to change our whole focus of our mission. So instead of having our inpatient missions, with our first one actually was planned for June 2020, everything had to be turned virtual. So we really had to see, like, is this possible? Is it possible to make a traditional inpatient or in-person mission virtual? And when we think of that, we have to think of, is it possible to even have that happen in terms of technological infrastructure? Luckily, Square Hospital has great technological infrastructure. DACA itself is really good in terms of internet and Wi-Fi. So far we have been able to convert some of our goals over to virtual. And right now we've provided educational webinars to all the pharmacists at Square Hospital. And currently we're in the process of modifying our objectives in such a way that we can still meet our goals just in a virtual way versus an in-person way until we can get back to Bangladesh.
So it sounds like there are a lot of changes have been made. Would you mind maybe elaborating on those changes that you've had to make to continue the mission?
For sure. So when the pandemic hit, we really had to step back, regroup, and modify our priorities. So initially, our first priority was focusing on the AST program at Square Hospital, because during the evaluation mission, it was identified as the most pressing issue to the institution. However, really, we had to make sure we could continue virtually, first and foremost. Like, was it possible to even continue the mission, or do we put the mission on hold? So we had to see, what was the technological infrastructure of the institution, which turns out to be great. So Square Hospital and Dhaka City has great, internet availability. So we were able to do that. We also had to have user buy-in. So we had to make sure that, the members on the Bangladesh team were willing to still be doing this virtually. We're willing and able to still do this virtually and continue the mission. And then we had to think logistically. So things like time zones, Bangladesh is 11 hours ahead of us. So in terms of having those in or virtual meetings and education sessions, like the interactive educational sessions, was the time zone going to allow for this? So these are all things we had to take into consideration. And luckily, so far, it has actually worked out. So in terms of modifying the priorities, instead of focusing on the AST program virtually, we decided to put that on the back burner and focus on the patient standardization counseling model. So what we've done is developed webinars, educational webinars that we've been giving to the pharmacists, really to incorporate more pharmacist participation and make sure that it's working at the pharmacy level before we go more institution-wide. So now that we've shown that it's virtual, like this can happen, we are adjusting the objectives, our initial objectives, to meet our goals, but in a virtual way.
That sounds great, and definitely sounds like a lot of work. So just wondering more about your team. What do the PSF volunteers do to support the mission? And are there pharmacists, other pharmacy technicians, or pharmacy students involved?
Yeah, so our team now consists of 4 official people. So myself as the mission lead, and then I have a great pharmacist from Ottawa. Her name is Caitlin Taylor, who's working side by side with me helping to develop and deliver these webinars, which is amazing. And then we have Zahidul Hassan. So he's my counter co-lead on this mission. So he's the clinical pharmacist from Square Hospital in Bangladesh. And then we also have Dr. Sitesh Bashar. So he would be the pharmacy director of Square Hospital, which really helps for user buy-in and helping to coordinate and having all the pharmacists be part of it. He's really helped to support that transition. So together, we're all working together to make these webinars, to carry these out and keep the process going, and also helping to make plans and modify the goals and objectives.
And speaking of plans, where would you say you are at in achieving your objectives for this mission so far?
For sure. So I would say we're still pretty early days for achieving our objectives. But now that we've successfully shown that we can convert our mission into a virtual mission and really have, feasibility of this virtual mission, we're able to move forward on our modified original objectives. And hopefully we're achieving some of our objectives and our goals within the next 3 to 6 months is where kind of we're at. With more of a longer timeline of like 1 to 2 years, we expect the mission to be complete.
That sounds really promising. Best of luck with that. And so far, would you mind sharing some of the successes from the mission?
For sure. So again, we've been able to successfully flip our mission from in-person to virtual, which I think is in an unprecedented time, which I think is pretty successful. We've also been able to expand our teams on both sides. So initially it was just me and Zahid working together, but we've each taken on more team members, and we're hoping to take on more team members as we move forward, which is really exciting. We've been able to develop the educational webinars, and these become resources that can now become a part of like the education and training of new pharmacists that come to Square Hospital. So we've allowed for an almost train the trainer type picture. So now we've given them the tools for their training further down the line. And we really helped to shed light on the importance of clinical pharmacy in a hospital, in Square Hospital specifically, really to encourage the user buy-in at the manager level at Square Hospital.
That sounds awesome. So for my final question, what lessons have you learned to improve the mission process in the future?
So some kind of like big lessons I've learned as being a part of PSF Canada and doing these kind of more humanitarian missions would really be to approach all missions with a very open mind and really be an active listener. So really understand what other people are saying or what they need in order to identify and have a collaborative relationship. So collaboration is key. Sometimes it's easy to go into a situation and think what is right or what should be done. But in reality, we have to be understanding of different cultural and societal differences and really work together instead of working in a unilateral way. And cultivating relationships is of utmost importance if you want any kind of success out of a mission. So really being open-minded is a big one. And especially now with the pandemic, I think patience is key. So it's always important to have a timeline, but it's also important to realize that, things happen and your timeline might change, and that's okay. As long as at the end of the day, you know where your project's going and you know that you can kind of make up that time elsewhere, everything's going to be okay. Patience is key.
You definitely brought up some really important points that I think everyone in this pandemic could apply. And so that concludes this webinar. Thank you again, Jaime, so much for offering your time and sharing your insights on this experience with me and our viewers today. Hopefully, through sharing these experiences, we can understand a bit better about how our missions around the world are doing during these difficult times, and realize that even though there may be differences, we share much in common and we are all in this together. Thank you again, and stay safe, everyone.
Thank you so much.